didn't help her.
Didn't help.
And she didn't like the feeling on Remeron.
Right.
And so ultimately in that message, you kind of reiterated what your overall recommendations were, right?
Yes.
And it was to continue with the Remeron for another 10 days, and that the alternative would be to restart Prozac and add the 25 milligrams of Seroquel nightly for anxiety and insomnia. Is that
Yes.
correct?
Yes.
And so were you recommending that she be on all of those at the same time? That she do the Remeron, the Seroquel, the Prozac?
Yes.
And in your experience in psychiatric care and prescribing medication, is it a common practice to pair low doses or doses of particular types of medications together to effectively manage a person's symptoms?
At this clinical juncture, my thought was the combination of Remeron with the Prozac to treat the depression with prominent anxiety, the Seroquel to help alleviate the sleep.
And you're also addressing the concern of benzodiazepine dependency, right?
Correct.
Did you encourage her to do something to help you to kind of manage her treatment track going forward?
Yes.
What did you encourage her to do?
I had noticed that Lindsay was attributing a lot of her symptoms to her medication. And so I attached to the MyChart message 2 different mood charts. And what those one is daily, one is weekly. What it is it asks the patient each day to rate their mood from like 0 to 3. Good mood, bad mood, normal mood. It asks about like, did you take your medications? What doses? What were they? Check the box. How many hours a night did you sleep? What's your anxiety level? What's irritability? And what I wanted from that was, because it had all those parameters about mood and then also the medication, did you take it? We'd be able to track over time what the progression was. Was it getting worse since we started the medication? Was it actually getting better? I just wanted more data.
And were you aware that she was actually tracking those things herself?
No.
Now, you continued to have some back and forth messages with her throughout the course of the day on November 30th, correct?
Correct.
So we have, she reached out to you at 11. You responded to her at 11:52.
Yes.
There's another message from her at 12:15, right?
Yes.
And just going back for a second, when you were asking her about worsening symptoms, did you ask specifically about suicidal symptoms?
I did.
And why those, if she was expressing some depression and sleep issues?
Suicidal thoughts can be a symptom of depression, and I just wanted to make sure I assessed that one because of its severity. And
is that something that's important to do before you make a recommendation to change a medication?
Yes.
Now, when she responded at 12:15, did she tell you anything about the suicidal thoughts, or if she was having any?
She said she's not at the point of being suicidal.
Okay. She also indicated, but I'm really feeling as if I can't go on like this, right?
Right.
And she asked you to call in the Seroquel.
She did ask me to call in the Seroquel, yes.
So based on her response, did you feel that she was taking the alternative that you were offering?
Yes.
And then at 12:29 p.m., you get another message from her where she asks for a phone call, right?
Yes.
And again, at that point, did you have a phone call with her, or did you continue to interact with her on the MyChart portal?
I interacted with her on the MyChart between patients, and I had my nurse give her a call.
And again, you said in between patients, so did you have the opportunity to pick up the phone and call?
I did not.
Okay. And is that one of the benefits of the messaging portal, that you can get back to somebody quicker?
Yes.
So when before you were able to respond, did she send you some additional messages on my chart, if you remember? Or if you could look at your notes.
Okay. I see that the symptoms of depression that she reported.
Yep, so just drawing your attention to 12:58 p.m.
Yes.
You get another message from her where she says, the symptoms of depression that are much worse are just feeling completely hopeless and unmotivated.